Hi, I'm Jim and I was retired. The Medicare season will soon be upon us, and for the first time in a few years, our DIY retirement will include an initial enrollment period and the annual enrollment period. I've been on Medicare for the nearly 4 years now, so I'll be using the AEP to review my options for 2026. But my wife is just turning 65 in January, so her IEP will begin on October 1st. In this video, I'll review the differences between the initial enrollment period that she will use and the annual enrollment period for those of us already on Medicare. Stay tuned for this DIY Retiree's 2026 guide to Medicare's IEP versus AEP. I'll also cover the key differences between original Medicare versus Medicare Advantage, and I'll outline the key steps that we're taking to get ready for Medicare in 2026. Keep in mind that Medicare has no family plans. Each of us needs to choose our own Medicare coverage. So unlike employer-based plans or ACA coverage on the marketplace, my wife can't simply join the plans that I've already selected for Medicare. She will need to make the right choices for her own coverage. Stay with me and I'll provide you what we're doing for our checklist for 2026. Let's get to it. If you are 64, you need to start thinking about your choices for Medicare. Now, there are special cases when Medicare starts before 65, and you may be able to delay signing up for parts of Medicare if you are currently working or covered by a spouse's employer plan. But for most of us, age 65 is the milestone for Medicare. If you've already started collecting Social Security, say you filed at 62, then you'll be automatically enrolled for Medicare for the month that you turn 65. But Marie has not yet filed for Social Security, so she will need to use this initial enrollment period. Your initial enrollment period includes your birth month and the 3 months leading up to your birth month, and then the 3 months after your birth month. If you apply in those first 3 months, then you're guaranteed your Medicare will start on the first day of your birth month. But if you wait for your birth month or the 3 months after, your coverage will start on the first of the month after you apply. So avoid delays and make sure you have coverage by signing up as early as you can during your IEP. Now here's a secret. You don't sign up for Medicare at medicare.gov. You need to log on to My Social Security account on ssa.gov because that's where your wage history is, and they'll be able to confirm that you're eligible for Medicare's Part A. As you enroll for Medicare, you'll make that fundamental choice between original Medicare with Part A for hospital insurance and Part B for outpatient services, or a Medicare Advantage plan that combines Part A and B and turns it over to a private insurance company for a Part C plan. I'm going to discuss original Medicare first here. As I said, you've paid for Part A coverage through your FICA payroll deduction taxes throughout your working career. As long as you have 10 years of contributions to FICA, you will get your Medicare Part A at no extra cost to you. There are some who don't have enough work credit, and they will need to pay a Part A premium, but for most of us, it'll be free. You will need to pay a Part B premium for outpatient services, though. If you're already on Social Security, it will be deducted from your benefits. But if you're filing later, you can pay for the Part B premium in quarterly payments or direct monthly payments. That's the way I do it for my Part B. Also note, in 2026, the Part B premium is expected to rise to $206.50 a month, according to the actuaries. They'll announce that officially in a month or so. But check out this video here. You should also add a Medigap or supplemental coverage plan to your original Medicare that will cover the 20% of medical costs that Part A and B don't cover. You might be able to have coverage from a current or former employer or union plan, but otherwise you'll want to select that Medigap plan. Now, you should also select a standalone Part D prescription drug plan each year. Hey, note, whereas your Medigap plan will automatically renew with no change in coverage, your Part D drug plan should be shopped every year based on the drugs that you take. Now, if you go with Medicare Advantage, they will combine Parts A and B and turn it over to an insurance company, and you'll use that Part C insurance company's card, not your Medicare card, when you go to the doctor or the hospital. Everyone on Medicare still pays that Part B premium because Congress wants us all to have skin in the game. And your Medicare Advantage plan technically includes that premium, even if the insurance company reimburses it in some form to you. Check your premium notices. Your Medicare Advantage may also include that Part D prescription drug plan and other benefits, including dental and vision. But be forewarned, you're no longer covered by Original Medicare. You are covered by an insurance company, and they will be able to limit the providers you see, the drugs that you can take, and you'll need to shop every year to ensure the coverage that you will receive for the coming year. Hey, before I go any further, will you please take a moment to like, subscribe, and share this channel, and hit that bell notification if you like entertaining ideas from a DIY retiree. My sister-in-law recently turned 65, but she's still working full-time for a larger employer. So she enrolled in Part A, that free part, but was able to defer Part B penalty-free because she has something that's known as creditable insurance. That's creditable. I'll spell that out here. Check with your HR. That means it's coverage that's equal to what Medicare provides for Part A and Part B. But make sure that your plan is creditable. Otherwise, you may have penalties later. Also, when your employment ends, you'll get a special enrollment period to sign up for Part B, a Medigap plan, and your Part D coverage in the months after your employment coverage ends. Or you might select a Medicare Advantage plan if you go that route. Two more notes for DIY retirees. If you are on COBRA or ACA, they will not count as creditable insurance. Because Marie has been on an ACA or Affordable Care Plan for the last few years, she will apply for Medicare at 65. ACA actually has rules in there that says you can't stay on an ACA plan if you're eligible for a Medicare. Fortunately, that means that we don't have to enroll for another year of ACA coverage in 2026. For those already on Medicare, the upcoming Annual Enrollment Period will be your opportunity to fine-tune the coverage for the coming year. That AEP will run from October 15th through December 7th. For those on Medicare Advantage or a standalone Part D prescription drug plan, this is the time to shop for the best coverage for the coming year. Insurance companies can change those plans every year, so you'll need to do your shopping. Now, your insurer should send you an annual notice of change by the end of September, and use that to shop smartly for the coming year. In my case, I'll be looking for my Part D coverage annual notice of change and use that to begin shopping for a new plan for 2026. And note again, you do not need to shop every year for your Medigap plan. That enrolls automatically at your anniversary or birthday. Technically, you can shop for a Medigap plan anytime throughout the year, but you'll likely have to go through medical underwriting if it's outside your initial enrollment period. For those preparing for AEP, here are the key dates. October 1st is when you can start comparing plans with your current Medicare coverage. October 15th through December 7th is when you can join, switch, or drop a Medicare Advantage plan or sign up for the new Part D prescription drug plan for the coming year. You can also use this AEP to switch from Medicare Advantage back to original Medicare, but your ability to sign up for a Medigap insurance may be limited by medical underwriting if you're outside that initial enrollment period. January 1 is when the new coverage will begin based on the changes you've made. Now, if you're a Medicare Advantage customer, you'll also get another opportunity to change from January 1st through March 31st. That's the period of time when you can switch Medicare Advantage plans one time during that period of time, or switch back to original Medicare, again, only once during that period. The change will take effect the first day of the month after the insurance company gets the change. And note that you cannot use this special period to go from original Medicare to Medicare Advantage. It's only a Medicare Advantage open enrollment period. You must do that during the annual enrollment period through October 15th through December 7th. So here are the big differences between the two options. Original Medicare may cost more than Advantage plans, but the cost will be more predictable. And you can see any doctor that accepts Medicare anywhere in the United States. There are no networks. That means you're free to travel in the United States as well. Some Medicare Advantage plans have zero premiums, but you'll have co-pays and deductibles that could add up. Make sure you check and research the costs of your plan every year. Medicare Advantage plans also make it harder to determine the full cost of medical care until you use it. And if you travel, you may have benefits only for ER coverage outside your home network. So a recap, the IEP is for those starting Medicare based on the birthday. In this case, Marie's January birthday means that her IEP begins October 1st. AEP, the annual enrollment period from October 15th through December 7th, is when those of us on Medicare can update and make changes for the coming year. Now, we're preparing to make our 2026 Medicare choices. If you're a DIY retiree, make sure you go to Medicare.gov and look for the Medicare and You 2026 guide and more. Also, be sure to give this video a thumbs up if you found it useful, and be sure to share this and my playlist here, Getting Ready for Medicare, with anybody you know that might be getting ready for Medicare in 2026. I will conclude with my standard warning. I am not a professional planner. I'm not a Medicare broker. I have no initials after my name, so always take these as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional if you need one.